Okay, well, welcome everyone. Welcome to the Commission on Excellence and Innovation in Healthcare's Improvement Showcase. We're very excited to have you all here today. This is Series 8, so this series is on ageing well. I'm Nadia Masterson. I'm the Director of the Partnerships Program and really happy to be hosting today and really excited about our presenters today too. Can I start by acknowledging that the land we meet on today is the traditional lands of the Kaurna people and that we respect their spiritual relationship with country. We acknowledge the Kaurna people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. I also recognise the lands that each of you may be meeting on today that may not be the lands of the Kaurna people. So for those of you not familiar, the Commission on Excellence and Innovation in Health is the lead agency for innovation in healthcare in South Australia. And we are all about bringing consumers, clinicians and collaborators together to turn ideas into better healthcare. That's our vision. To do this, we really need to think about how we can create and imagine new ideas. And we recognise that excellent isn't always, well, better isn't always excellent, but we commit to measuring it and measuring the changes that we make along the way. So in terms of, this statement is perfect for the Improvement Showcase, because what if the big idea was connecting the small ideas? And that is what the essence of these showcases is all about, to connect us all together. It's South Australian centric and it's about supporting our ideas and our learnings as we go. Now, I just want to check. Jeanette, can you give me a wave if the slides have been moving as I've been presenting? Yeah, great. Thank you. So our improvement showcases, they're on Thursdays at 1 o'clock or online whenever. They're taped, as you know, this is being taped and they're available on our website. It's all about bringing healthcare teams together and providing that space to explore what others have learned and about keeping it simple. Apologies. So have you got a story to tell? We want to hear from you if you've got a theme you want to explore or you've succeeded in solving a problem or you've learned something. This is about connecting us all together. So please contact us and let us know. As I mentioned, this is Series 8 on Ageing Well. I was really excited to host Kathy Williams from the Office for Ageing Well at our last, and she talked about a really innovative vision for ageing well for the state. On the Thursday, the 17th of March, we're hearing from Mandy Ross from ECH about their innovative care hotel approach. And really excited today to welcome Jeanette Walters. Jeanette is the Executive Director for Integrated Care Systems, and Monica Novick, who's the Assistant Director for Primary Care Integration, both from Wellbeing SA. And so can I just remind you to all keep your cameras off and obviously your microphones on mute. At the end of this session, we'll open up for questions and answers and we'll stop the recording to make that really easy to do. So I'd love to hand over to Jeanette and Monica today, who are going to speak about coordinated, connected and collaborative care, helping older people to age well. I'm just going to stop sharing screen.
We're just setting up our slides. Just give us
no worries. Do you want me to, I'll just keep this screen up for you.
2 seconds.
No worries at all.
Okay, share. There we go. Can you see ours now?
Yeah, if you just go to presenter view.
Yeah. Right. Hopefully that's, how's that? Can you give me a wave now, Nadia?
Yes, we can see the notes and the next slide coming up. So if you just go to the top to display settings.
Oh, we've just did that. So is that better?
Now you've got it. Perfect.
Okay, perfect. Excellent. Thank you. Last minute technical dramas helps if you've got the right presentation on the screen, Nadia. So thank you for the introduction, and my name's Jeanette Walters, and with me I've got Monica Novick, and we're going to tag team through our presentation today. I'd also like to start by acknowledging that we're meeting today on Kaurna lands and pay our respects to elders past, present and emerging. So, I'd like to start by just giving you a little snapshot about Wellbeing SA. We are an attached office that was established, not unlike the Commission, in early 2020. And Wellbeing SA is really committed to the prevention and early intervention activities in the health sphere to keep South Australians as well as possible and to reduce the need to use the hospital system. We're about working collaboratively with our partners to unlock our opportunities for care, and in particular, the area that Monica and I work in, which is the integrated care systems, in how we integrate care across the healthcare continuum at an individual, service and system level. We're about recognising the importance of integrated care to ensure people with chronic and complex conditions can receive the best care close to their home and community, and also that they have a positive healthcare experience. One of the key actions of the Wellbeing SA strategic plan that you see on the screen in front of you was about developing an integrated care strategy, and Monica's going to talk to you a little bit about that now. So I'm going to pass to you, Monica.
Thank you. So our integrated care strategy was released last month and was developed during last year. It basically presents a roadmap for Wellbeing SA and our kind of key partners around the work that we want to do around integrated care, and identifies those opportunities and areas for key actions. The vision for the strategy is around improving the healthcare experience and outcomes through better coordination, connection and collaboration. And I think what's important here, and what we heard during the consultation phase, it's not just about health outcomes, but the experience people have when they receive their care and transition through care is really important to their health outcomes and their healthcare journey, and important to both consumers, families, carers and clinicians as well. So why is integrated care important for older people? We know the many challenges that older people face, particularly in South Australia with an ageing population. Over 16% of our population is aged over 65 nationally. In South Australia, that's over 19%. There's a growing prevalence of complex and chronic conditions, and we know, unfortunately, as we all age, we become more likely to have multiple conditions and multiple things that we are trying to manage around our healthcare needs. That we need to assist people with how they navigate. Our health system is really complex, and navigating through that system is really challenging. And when you've got multiple conditions, you need to use multiple different providers in our specialised healthcare system, and transitioning across that environment really needs to be integrated so that you're getting holistic care and that your care experience works for you. And it can become really challenging to manage your care needs across multiple providers. And we need to make sure that ease of navigation, that ease of communication, that enables safe transitions, that avoids unnecessary hospitalizations and stops people having to tell their story again and again. Now, and we know as well that, you know, lack of healthcare or inappropriate healthcare or falling through the cracks around healthcare is one of the key reasons for early retirement, because people become unable to continue to work, and work and connection and community connection is equally important. So the integrated care strategy.
Oh, did I go one?
Yes.
I jumped one, sorry.
Yeah, so sorry. So we did a series of engagements last year to inform the development of the strategy. So that was around people with lived experience of chronic conditions, their families and carers, health professionals, right across the spectrum from pharmacists, allied health, specialist clinicians, GPs, community workers, and also community sector organisations with that expertise in chronic conditions, working with families, working in advocacy, to really get a broad input into what integrated care needed to look like. Part of our process was focus groups across both metro and country with each of those different kind of cohorts of people, and targeted and general workshops, which brought those people together to do some of the input and brainstorming and collaboration. And that was really, I guess, that partly informs our integrated care partnership, and that importance of partnership and design came out in that engagement. And we also undertook a community survey of people with chronic conditions. We have is around improving the healthcare experience and outcomes through better coordination, connection and collaboration.
We're now unmuted.
And at the centre of that is the individual and the their management. So recognising that their self-management, their primary and community care, their tertiary care and their support networks. We've identified 3 priority areas, which is putting people at the centre of their care, delivering connected care and working together as a system. And then we've got 4 strategy areas and a set of principles that complete our rainbow. And at the bottom are kind of the areas that we want for measuring our progress against that. And I'll talk a little bit more in detail about each of those priorities now. So the 3 priority areas are about putting the person at the centre, which acknowledges that there are many interactions across the care continuum. And we want to put people at the centre because the navigation of their care and the tools they need to support them as active participants in the coordination of their healthcare journey and in decision making, enabling access to information and prioritising that consumer and community engagement. Some of the strategies we want to use is leveraging new and emerging technology to help healthcare be delivered closer to home in a setting at a time that better suits people's needs. That was one of the strong kind of comments from the consultation around the person really needs to be at the centre and everyone needs to kind of work around that. The delivering connected care is really looking at the connection across services. So how do services relate and integrate together? And working together as a system is recognising that we need to work together as a whole system in terms of planning, our joint initiatives, our partnerships, how our funding models work, how our services, how our whole system works together. So integration needs to occur at each of these levels in order for us to deliver the kind of outcomes we want for consumers and people with chronic conditions. And that's particularly important for our older people. As part of our program for the integrated care strategy work, we've been supporting chronic disease partnership grants, which we established last year. with the aim to improve the integration and quality of healthcare for people living with chronic conditions. Again, I guess what underlies this is partnership and trying to build partnership. We've done 2 rounds of grants. We did one in June 2021 and one in December and 2021, not 2022 yet. There's been 9 grants awarded, and we're trying to build on existing services, programs and initiatives, and identifying where we can support the development and sustainability of practices. But more than these programs, because they are small grants, it's really about what's the sum of the parts, the greatest sum of the parts coming together. So to assist with that, we've actually engaged with the Australian Centre for Social Innovation to work with our grantee recipients and to bring them all together in a series of workshops to work together and collaborate. So these are sometimes bringing together people who haven't worked together in the past, finding new connections and finding new opportunities for further innovation in addition to the grant program that they're actually delivering. Each of those, part of what Taxi does is work with people to develop their theory of change, and Taxi have a very strong background in consumer focused and consumer involvement and consumer engagement. So they help our grant recipients to refine and develop their project planning and do mentor and coaching and work on the theory of change. And we're also creating a grant alumni to bring that integration together and create new connections, because we know integrated care at the end of the day is developed through trusting relationships, and we need to bring people together and connect as a system. So just briefly, as some examples of a few of the people that we funded and some of the work we've been doing, we've funded the South Australian Postgraduate Medical Education Association to look at developing primary care knowledge and self-efficacy and best practice around management of complex health conditions. And they're partnering with our local health networks, primary health networks and general practice organisations across Australia, providing an extension of the Community Healthcare Outcomes Hub, using virtual technology for interprofessional education and case-based learning. And that's facilitating learning through real live case discussion, encouraging information and knowledge sharing between participants, and again, forming a community of practice around that shared learning. Viva Mutual is a disability service provider who's looking to work with GPs and other primary health practitioners to make sure people with disability who have chronic conditions are actually getting the integrated care they need and getting early intervention in their chronic disease. Diabetic Association of South Australia is doing some interesting technology work around type 2 diabetes to look at the evidence for having utilising technology to assist consumers in managing their intake of food and the time of that intake, and to look at how that changes behaviour and supports them in managing their health condition. They're also doing some work with the Indian-born South Australian community to work with them around the types of strategies they need for healthcare, specific materials and referral mechanisms that respond to their culture and language needs, improving health outcomes, because this cohort and this community are at higher risk for poorer health outcomes, and working closely with the various Indian communities to inform that strategy. We are also supporting Palliative Care SA around a symposium to enhance the education and support training and delivery around to share insights for supportive care planning around for people with advanced chronic disease through a symposium and training, which would then be available online and continue to be delivered.
So I'm going to take over now and we'll swap our topic to also talking about some of the services that My Home Hospital delivers and its relevance in ageing well. And certainly one of the things that we've heard and Monica's talked about is about people wanting to get the care that they need, their health care that they need, in a setting that's most appropriate for them. And particularly for people as they age, we see that sometimes they have their home set up in a particular way that maximises their independence. Being able to have their healthcare service come to them in their home rather than having to go to a hospital is seen as being a really great outcome for many people. So a little bit of background: My Home Hospital is a hospital in the home service that delivers hospital level care within the comfort of people's own home. It is a Wellbeing SA service that we've contracted a joint venture between Calvary and Medibank to deliver. It's at no cost to eligible patients and is available across the metropolitan and some peri-urban areas, which is excellent. It provides all the things you'd expect in a hospital: care, doctors, nurses, imaging into the home, other diagnostics, and also your medications, etc. Bit of information, we've had over more than this now, 2,100 patients to date, but I thought it was interesting to see some of the breakdown in ages. Not a surprise, I'm sure, that we see a higher proportion of people aged 65 and above, but it's pleasing to see that we've had people over 100 years of age in the service and really enjoying being able to receive that care at home, particularly for people who are reliant on those other environmental setups to increase and maximise their independence. It's also been a well picked up service within residential aged care, which is a really nice thing to be able to see that service being delivered in that setting. When we did set up this service, we took quite a bit of time to think about the people who would be using the service and to have their involvement in our co-design process. And so we made sure that we included older people within our co-design groups, people also who were carers, and people from a whole range of different cultural and other backgrounds from regional and metro settings. And you can see some nice comments that were part of that service then. We've had 3 different sets of workshops to date, the ones right at the beginning of the service, and then as we've expanded in May and June of last year, and we have a continuing commitment to keep coming back to the community to check in and ensure that what we're delivering is in line with the principles and the advice that they've provided us right from the start. You can see a bit more information about that as well. The groups that we've been targeting more recently in this space are working with both residential aged care providers and residents, home care package providers more recently and their clients, and also retirement living operators and their residents. And so we've done quite a lot of work with those different cohorts to understand how the service might look different in the settings that they're living in, and ensuring that we're working really closely with aged care providers so that they continue their service for the individual while My Home Hospital walks side by side delivering the hospital level services. That way we're not kind of picking up people and saying, here's a whole new lot of people providing your care. There's still the familiar faces coming in to do the services they would normally receive, and the My Home Hospital team working alongside them. I thought a couple of patient case studies might be interesting for people to see some of those different scenarios in practice. Here's an example of a man living independently in a retirement village. He was in hospital and was keen to be back home. And he had the nurses coming in a couple of times a day to provide his IV antibiotics and undertake regular observations. He had his SA pathology come and do his bloods and his urine tests. And he also had a range of virtual monitoring devices within his home that enabled the virtual care centre of My Home Hospital to keep an ongoing view of how he was progressing. So some very easy technology that enables the person to undertake some regular questionnaires and some checks on their wellbeing and their observations. That goes Bluetooth through to our ongoing monitoring service, and they keep an eye on how that person's going. They've got parameters set up of what they would expect the person to be, how they'd expect the person to be progressing. And if they're falling outside of those areas, they've got a number of options that they can pursue. They can have a phone call directly or a video call directly with the doctor and the patient, or they can send somebody out to the home to have a closer look. So there's a lot of that, both in home care, but also virtual care. The person was changed to oral antibiotics after 4 days, and most of these lengths of stay are relatively short, and they had their home care package support continue throughout. For all of the patients in My Home Hospital, there's a discharge letter that goes to the GP as well as the referrer, and a follow-up appointments made with the GP as required. There's another example here regarding a person in an aged care facility who was seen around his aspiration pneumonia. You can see here that he was able to have oxygen therapy put in, chest physiotherapy, had the daily ward round to monitor how he was going and working with the nurses in the facility, but also the My Home Hospital nurses coming in directly to support his care. So a bit of feedback from you about the patient experience to date. So we are part of the SA consumer experience surveillance system that all hospital patients are asked about. And to date, we've had 2 of those surveys come through, and you can see some really positive feedback from people who've been in the service and how they've experienced that. And here's one of our very happy recipients of the service. And so David was the patient himself, and you can see his comments on the right of the slide and his wife's comments on the left. So we do try and check in on a regular basis to get a sense of how it's working out for people on the ground and making sure that it's meeting their needs and that we're continually improving. And so this goes back to the comments that I made at the beginning and Monica made in our strategy, that it's definitely about patient outcomes that we're interested in, but also the healthcare experience. And that's a really critical thing for us to keep in mind. So in conclusion, and to give an opportunity for any questions, Wellbeing SA is really committed to improving healthcare experiences and outcomes. Hopefully that's in people's minds. That's one of our key messages for you today. And this enables people to support them aging well. So whether you're 16 or whether you're 66 or whether you're 106, we want everybody to age well. But we have had a particular focus on how we make sure our service supports people who are in those older years, to ensure that they're able to maintain their independence and that they are able to receive the care that they need with all those supports around them with minimal interruption to their life. We are certainly setting up an advisory committee. So in our commitment to ongoing engagement, we'll be continuing to look for new opportunities and activities to contribute to our integrated care work. I think now that's enough of our talking, and we would like to hand over to see if there are any questions. And would you like me to stop sharing for that?
That's wonderful. Thank you, Jeanette. Yes, if you stop sharing screen, that'd be lovely. And we will stop recording now also.